Okay, nice to see all of you guys here. We're going to go over just a few things that we have to go over before we do our first day of clinic on Monday. So we're just going to touch on a few basics. This is what we're going to go over today. When you hear the words universal precautions or standard precautions, what it basically means is that no matter what, you're going to assume everybody is contagious with COVID or HIV or whatever, right? So we wouldn't want to treat somebody different just because they have HIV. We're going to assume everyone does. And the reason why is because a lot of times either one, people don't know they have COVID or whatever, and or they don't want to tell you because they're embarrassed about it or whatever. So basically, we're going to assume everybody's infectious and we're going to treat them that way. Okay, so meaning that no matter what, you're going to protect yourself. So we have to make sure that everyone knows this and learns this because we want it to be consistent among everybody. If you're being really cautious, but your neighbor is touching lots of different things and then you go and touch them, well, that doesn't really help you because now you're going to get sick through cross-contamination. We'll get into that a little bit later. But so that's why everybody needs to learn it and follow the same protocol. We also need to revise the plan as needed. For example, there is a lot of things that we are doing differently now that COVID-19 has come around. Before COVID-19, we didn't use respirators, the KN95. We started using a high-speed evacuator when we are using doing airborne procedures that you'll learn about and things like that. So if something new happens, we always have to keep revising and make sure that we're current. And we want to use physical barriers that we're going to talk about in clinic as well. There's other really important things that we do to protect ourselves. One is immunizations. Now, right now, there's a lot of talk about COVID-19. I think the majority of people here will have had it. If you have not, I highly recommend you get it. And the reason why is because the dental hygiene program is so demanding, if you had to take 5 days off to isolate yourself, you would, one, be so far behind, you wouldn't be able to keep up. And two, if you miss that many days, we actually start to kick you out of the program. And so we wouldn't ever want that to be a problem for you. Of course, there's breakthrough infections and things like that, and we've tried to work with students, but it really puts you in a bind. So try to get immunized, and that's why we require all your immunizations when you start the program as well. Other immunizations that you've had to get is like hepatitis B. We require the flu shot, all those kinds of things. It's because we want to make sure that we keep people healthy. And then we want to make sure we maintain accurate records. You guys have to submit that. We, make sure that we have those on file so we're aware of where everyone is at with that. And I can't find there we go. Okay, here's a few comments. All we have to do is place them on the waiting room chairs. We could say that about COVID shots too. Just let them sit on it. It's normal to experience mild side effects, but severe reactions to vaccines are very rare. Health experts are closely monitoring this, and so far research shows COVID-19 vaccines are safe. Unfortunately, with COVID, there was a lot of politicalization, and I think it's kind of calming down since then. But, if you have questions, I actually have another slide next here that talks about kind of the evidence of the COVID-19 safety. And, different populations tend to be more skeptical or maybe not as accepting, of government-issued things. And I just want to say, in a science profession like this, we always try to follow the evidence. And here's just a few articles that you can look up if you still are feeling afraid or alarmed to get the COVID-19 vaccine. So I want you to think, what are some examples of personal protective equipment? And I'll just let you think about that for a second. So we say PPE, and I don't know that people really knew what that was before COVID, but I think even the general public has heard PPE because there was a shortage of PPE, right? So here's some of the things that come to mind. You've got your gown and jacket, that's to protect your clothing, your gloves, your shoes or shoe coverings, your mask, your eyewear, your head covering, and a face shield. Let me go back a second. So even your shoes, they should be able to be easily wiped off. It's better to have like a leather or faux leather as opposed to like a mesh thing because it will protect you can wipe it off easier. Talking about things that have changed since COVID, the head covering was something we really didn't do or require before, and now it's starting to be more of kind of a standard precaution. Okay. Anyways, this is something I want to show you. Before COVID-19 started, I found some pictures like this, and I showed it to the first year students that I ever taught, and they were like, ha ha ha, that's so funny. And the weird thing is now this is like I shouldn't say as much now, but when COVID-19 first came out, this was the reality. I mean, people were suiting up and like covering themselves, and the head coverings, it was like, who wore that? Now everyone wears them. So it's just kind of interesting to see how things change. When we talk about masks, there's different levels of masks. And so when you look on the box of a mask, it will say level. Now in general, in dental hygiene, we use a level 3 mask. Level 3 is for high splatter, fluids or aerosols like the ultrasonic that we're going to teach you to use. And so that's what has kind of been the standard of care. But now that COVID has happened, if you're doing aerosol procedures, because of the highly infectious nature of COVID, we have started using the KN95 in our clinic. And you'll notice that it fits a lot closer. You don't have the gaps like you would in a regular mask to try to prevent infection from either way. But if you look at a level 1 mask, a low fluid or splatter, so this would be like if you're cleaning your room or something, and or a moderate splatter, if you're just hand scaling, you could do a level 2. The reality is people don't have 3 levels of masks. And so because we deal with aerosols frequently, most offices will always just have a level 3 or N95 or KN95 mask. You will want to look when you get to your office to make sure that they have at least, at minimum, a level 3 mask for you to use. It protects you and it protects the patient. Another thing that you will want to know is you're going to replace it for every patient or if it becomes wet. So if you start feeling spatter, that's one of the reasons we started wearing the face shields, is to prevent the splatter from getting your mask wet. Because once it gets wet, it's more likely to become contaminated and seep through. Okay, we talked about that. We're going to talk about how you put on the mask when we're in clinic on Monday. And when you take off the mask, you never want to touch the mask part of it. You're always going to grab the elastics and kind of pull it off from there. And we'll talk about that in clinic as well. Another important thing is the use of eyewear. Now, I have heard stories of people dropping instruments on somebody's eye and blinding them. I've never done that, but I have dropped an instrument like on their cheek or something like that. You just never know. One thing that you will learn is you should always pass instruments below the chin so that we don't ever have to deal with that. But so you want to protect your own eyes and your patient's eyes. It should be worn for all procedures, and that includes when you're sterilizing instruments, or if you're cleaning your room, you want to keep those eye glasses on. And if you look at some of the qualities of good glasses, they'd be shatterproof, easily disinfected. You want to make sure they wrap around and cover the sides, and you want them to be lightweight. Sometimes for patients, if they're sensitive to light, they'll like tinted ones. A lot of times kids will as well. So sometimes a good pair of sunglasses works as well too. Today, on Monday, we're actually going to order your loupes, which actually have the magnifiers and the light source. And so that's a really great way to cover and protect your eyes. If you get something in your eyes, we have something called eye wash stations, and we'll show you where these are in the clinic. And basically what you do is you take the cap off, turn on the faucet, and it will flush your eye and you should flush it for about 15 minutes to make sure there's nothing in there. Make sure on your loupes, you don't use paper products to dry them. And she's going to go over that on Monday too. So I'm not going to spend a lot of time on that. So I'll kind of skip forward and let her cover that. Okay, hand care. I like this thing. Women in the dental field. The reality is once you're in dental hygiene, just prepare for the next 2 years. You cannot have nail polish. You cannot have artificial nails. It's all gone. Look at me. Whoops. I don't. But yeah, my nails are not nice. They're not long. They're not pretty. It's because what happens is bacteria, the studies have shown that bacteria can harbor underneath nail polish. So they've told us not to wear them. And then similarly, if you have watches or jewelry or earrings and things like that, you can get bacteria in there. And so here at our clinic, we choose not to, just to kind of make a blanket statement, you should not wear watches, jewelry. If you have a nose ring or anything like that, it has to be taken out. Even, cartilage piercings, nose rings, anything like that, they must be taken out for clinic. We will go over washing hands in clinic, but a couple things to just realize. The reasons why we do it is we're trying to remove dirt and transient bacteria. So if you're washing your hands, this is if you see something actually on your hand that is dirty. If you are just between patients and you don't have visible dirt, then you can just use sanitizer. Also, you should always wash your hands with soap at the first part of the day or after you come back from lunch. And then after that, you can sanitize unless you see visible dirt. The nice thing about our facility is they have the automatic where it senses you. Sometimes they don't work as well. They'll stay on or things like that. But that is the idea, is that we don't have to touch anything with contaminated hands. Make sure that if you use towels, that it's a disposable towel so you can discard it after you're done. Now, we're going to go over hand washing in the clinic. This talks about these things that I just talked about. Okay, before and after treatments. So hand hygiene refers to either hand washing or sanitizing. So if you look at it, before and after treating patients. So if you go from a patient to a patient, you're going to do it before and then when you're done. After touching a contaminated object. So anything could be contaminated. If you grab a chart or something like that, when your hands are visibly soiled, you're for sure going to hand wash before leaving the treatment room. There's different types of hand washing. There is routine hand washing, which is kind of just normal washing in between patients, whatever. Antiseptic washing is going to have more of the antimicrobial liquid soap. Antiseptic hand rub, same thing. And then surgical abscesses is like the full-on, scrub under your fingernails, all that kind of stuff. And that's usually for surgery. We're going to go over this in the clinic. Another thing to be aware of is dental gloves. How to put them on and turn them off. We're going to go over this in the clinic, but just be aware that you'll notice that you're not ever touching your skin with the other contaminated glove. And so you'll understand that a little bit better when we're in clinic. Latex gloves can cause allergies in certain people. So usually most dentist offices have gotten away from it because not only the clinician, but also patients can sometimes have a latex allergy. And let's see, we'll also go over fitting gloves in the clinic. We want to make sure it's not too tight. If the gloves are too tight over the long term, it can cause stress on the hand, which can lead to carpal tunnel, things like that. So you want to make sure there's a little bit of, we'll kind of discuss that in a minute. Okay, this is showing a picture of a latex hypersensitivity, this kind of red rash. And I think once people get it, it doesn't really go away. You may not have it right away. It may happen later. But if you notice that a patient gets this, you want to make sure you mark it on their chart so that we know. And this actually can lead to anaphylactic shock, like a medical emergency. Okay, that's all up for today, and I'll see you in clinic on Monday.